You might be wondering whether you should be doing the insemination treatment or IVF treatment. What is the differences? Which one is better? Welcome to Fertile Minds. I'm Dr. Peter Leung, obstetrician, gynecologist, endoscopic surgeon, and fertility specialist working in IVF Australia. In here, we're talking about the differences between the two treatments available for you, as these are very different treatment options and obviously can suit different people. So if you're struggling with fertility problems, you're not alone. In fact, 1 in every 6 couples in Australia is actually having problems of infertility. Now, more often than not, the causes of infertility can be shared between the couple themselves, right? It's not just confined to the ladies. We noticed from our statistics that about 1/3 of the patients have had some problem with the lady side. 1/3 of the problem is actually coming from the male partner. And we also get 1/3 that both of them has had some contribution. So in today's visit, I'll be talking about whether you should choose insemination as a treatment options, or we should choose IVF as a treatment options. But which one we should do? Most people would think that insemination treatment is a more simpler form of treatment. They are more gentle on your body and doesn't require a general anesthesia or surgical procedure. So most couple would be happy to consider insemination treatment as a stepping stone before they go forward in try out more intensive treatment such as IVF. Obviously, in going through to the IVF treatment process, we do bypass a lot of natural block in fertility, and so in general, the success rate of IVF is slightly better than insemination. We also like to obviously discuss with the couple exactly what the couple would need based on their particular medical circumstances as well as social circumstances. So one treatment is not necessarily better than the other one, but your fertility specialist will be the best person in order to dissect all the differences between the good points and bad points of that particular treatment in your circumstances, so as to recommend a best option for you. So first of all, let's talk about the differences between the two. What is insemination treatment? Now, artificial insemination or intrauterine insemination is essentially the process where we prepare a male partner's sperm and insert it through the neck of the womb into the uterus, usually around the time of ovulation, and making sure that the timing is suitable for implantation to happen. It can usually be divided into 2 ways. You can either do it naturally, where we monitor the lady's natural ovulation timing and then basically putting the sperm into the right time for fertilization to happen, or you can through the use of medication, such as use of oral medication or injection medication to bring along the ovulation so that we can put in the sperm at the appropriate timing and fashion. On the other hand, if you're doing IVF treatment, we are talking about much more sophisticated treatment, where we would usually need to give medications to the lady to bring along a group of follicles to come through. And thereafter, we need to do a minor surgery to collect all the eggs out of the body. At the same time, usually the husband or the partner need to give us a sperm sample, where the laboratory would then be able to join the eggs and sperm together to create an embryo. After 5 days of culture, then the laboratory will be able to pick up the best embryo and then insert it through the womb, and hopefully an implantation would happen. In that way, we have bypassed a lot of natural barrier of conception, infertility, such as the blocked fallopian tubes or the difficulty in the eggs finding the sperms. So what is the differences between the two, and why do you want to use one over the other? It really depending on the causes of the infertility as well as your social circumstances. For example, if you're talking about a couple more having issues of mild factor infertility, cervical mucus problem, timing issues, or sexual dysfunction, then perhaps an insemination treatment may be suitable for you guys. This is obviously only available if the semen quality is of sufficient quantity, as well as the anatomy would allow the sperm to be able to see the eggs. So that means the fallopian tube has to be opened. On the other hand, if you have a very severe male factor infertility, that means that there's only a few sperm available, or the sperm simply refused to fertilize with the eggs. Or alternatively, there was a significant anatomical problem, such as the fallopian tube is being blocked, or you get severe endometriosis, then this may not be a suitable option for you. In addition, for some of the couple, if they are considering using donor sperm as a treatment options, then these can also be considered depending on their social circumstances. If you are using it for single women or same-sex couple, then the insemination can still be considered as one of the alternatives. However, if it is a significant problems in terms of genetic problems that you want to identify, or you want to exclude severe endometriosis problem, then perhaps IVF is a better option for you. So overall, this really depending on the couple's circumstances or the individual circumstances, and I'm sure your fertility specialist will be able to dissect the way to you, as well as talking about which is the most suitable options. If you'd like to know more about fertility treatment options or would like to watch more contents, feel free to click the subscribe button. I'm more than happy to answer any questions you have, so also feel free to leave any comments below so that we will be able to be in touch with you. Otherwise, enjoy the video and thank you for watching.